Hello, my name is Kitnoy Poma, and today I'll be performing the dressing change using sterile technique for wound care. Before we get started, this is my biohazard bag. This is my wound with the old bandage on it. This are my gloves, and this is my wound care kit and my hand sanitizer. So I'm gonna go ahead and get the patient's full name and date of birth. I'm gonna do hand hygiene before going in, and then I will be explaining the procedure to them, and then I'll be looking at the wound to see if there's any abnormal changes. So first I'm going to get my hand sanitizer on. I'm going to knock on the door. I'm going to close the curtain or close the door for privacy. So knock, 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 closing curtain for privacy. Hello, Miss Poma. My name is Kitnoy and I'll be your nurse today. I'll be doing a dressing wound change for you. Would you like to go to the bathroom or do anything before we get started? No? Okay. So can you go ahead and confirm your full name and date of birth for me while I look at your wristband? Okay, thank you. So I'll be taking your old bandage off, cleaning the area, inspecting for any abnormal findings, and then I'll be putting on a new transparent dressing for you, okay? Does that sound good? Okay, so if any time or any moment you feel like you're in pain or you're hurt, just let me know, okay? Okay, so I'm gonna get my hand sanitizer on again. And I'll be putting my gloves on. Okay, Miss Poma, I'm just gonna go ahead and get your bandage off, okay? So I have my gloves on, and now I'll be pulling the bandage towards the inside of the wound and holding down on the skin because we don't want to pull it off too fast. Miss Poma, are you okay? Okay. And I'm making sure that my scrubs are not touching the table and my wrist and elbows are above my waist. Just holding down on the skin and pulling towards the inside of the wound still. Alright, so I pulled it off. Then I'm gonna toss this in the trash. Okay, that's in the trash. So now I'll be removing my old gloves. I'm gonna be doing my hand hygiene again. And I'm gonna open my wound care kit. Tossing this in the trash. I'm gonna get my sterile gloves. Tossing this in the trash. Then I'm gonna go ahead and cuff under here and pull. So now I'm gonna don my dominant hand first, and that's my right hand. So I'm just gonna go ahead and pinch. And then I'm gonna slide my hand in there, making sure that I am not touching my wrist or any parts of my hand. There you go. I have it on. Then I'm going to be donning my other hand, and I'm just going to be putting my 4 fingers under the cuff, making sure I'm not pinching it. So right under. Then I'm going to slide my hand in there and pulling. making sure I'm not touching my skin. And there you go, I have my sterile gloves on. So now we're gonna be cleaning the wound. So I'll be grabbing, this is gonna be my dirty hand, this is gonna be my clean hand where I'm grabbing inside of my kit right here. So I'm gonna grab the alcohol, this is the alcohol, and I'm gonna drop it into this hand. So we're gonna be cleaning from inside to outside. So I'm gonna be cleaning the inside first. So around one time, then I'm gonna toss this and get a new one. I don't have a new one, so I'm gonna be using the same one. So I'm gonna take it same from here and then throw it into, or place it into this left hand, and then we're gonna clean the outer edge of the wound. Then we're gonna toss it. And then now we're gonna dry the area with the gauze. So I'm gonna pick up this gauze and drop it into my hand. And I'm just gonna dab from inner to outer. So first I'm gonna do the inner. So dab, 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 dab. And then I'm gonna toss it in the trash. Then I'm gonna get another gauze, put it in that hand and dab on the outer edge to make sure it's dry. And I'm gonna toss that. So now I'll be using this hand to inspect the wound for any edema, if the tissue is bleeding, if there's necrotic tissue, if there's any abnormal colors, if there's any odors or drainage, and if I will measure and write it down if there is any. So now I'm going to be feeling for the edema. There's no edema and no abnormal tissue. I do not see any odors or smell any odors, and I don't see any drainage or yellow pus coming out. So I just inspected the wound. So now we're gonna apply the transparent dressing. So I will need both of my hands to put the Tegaderm on top of the wound. So I'm still gonna use my clean hand first to grab it. And then I'm gonna use both of my hands to open it. And now I'm just gonna open up this. And this is a smaller Tegaderm. I had to go out and get a different one. So now I'm gonna be peeling it and tossing that. So I'm gonna put this on the wound now. And then, let's see. It's not gonna cover all of it, but I'm gonna pretend that it's covering all of it. So I'm gonna put that on there, place it like that, and press it down so the sides are not coming out and there's no other exposure. So pressing down a little bit on the outer edges. Then I'm gonna pull this off, holding down on that skin still so it doesn't pull up anything else, and toss this. So now that I have the dressing on there, I want to make sure that I write my initials and the date so other people know that this is when I changed the dressing, and so that I know this is that I changed it as well. And I'll be sure to write that in my notes to make sure the other nursing staff or oncoming staff knows that we just changed this. So now I'll be moving, not changing my gloves. I'll be throwing away my gloves, cleaning up my area. So Miss Poma, I'm all done with our procedure. I'm just gonna be cleaning up the area, and then I'm gonna go and chart all of the findings that I found. There's no odor, there's no drainage, and your tissue looks like it's healing normally. So there's no other findings that I am seeing right now. So I'll be discarding of my whole kit first. And then now I'm going to be taking off my gloves. So I'm pinching and pulling. Then I'm going to ball it up in my hand. And then I'm going to use my 2 fingers without touching the outside. My 2 fingers to pull it off. And then I'm going to bundle this and I'm going to toss it in the trash. And now I'm going to do hand hygiene. And I'm going to toss this away in the trash. I'm going to do hand hygiene again because I don't want to contaminate anything. Okay, Miss Poma, I'm all done. Do you have any questions for me? Okay, do you need to go to the bathroom or do anything? Okay, so I'm going to go to the nurse's station to chart all our findings and document everything. I'm going to leave the call light right next to you, so if you need anything, please use the call light, okay? And my procedure is done.